Good morning, everyone. I'm Matteo Di Gioia from the Gioia Martinetti Orthodontic Practice. Today we will talk about the type of malocclusion that probably occurs most frequently, which is class 2. This means when the teeth don't fit together properly, and it's usually noticeable because the front teeth, the incisors, stick out a lot. Or the incisors are tilted significantly far back due to an incorrect and improper fit of the posterior back teeth. By class 2, we specifically mean this particular kind of dental situation, where the upper and lower teeth close one tooth against another single tooth instead of the more ideal and proper closing of one upper tooth against two lower teeth. This condition often requires orthodontic intervention. And in fact, in the anterior region of the mouth, these prominent upper incisors typically protrude significantly forward and consequently impart a very distinctive and characteristic appearance to this particular kind of dental malocclusion, which is often quite noticeable. Let's consider that these green lines at the back these red lines at the back should precisely coincide, while the upper red line should be positioned behind the lower one. This is what happens once the class 2 malocclusion is corrected, where the teeth fit together properly. Now the green lines coincide and the upper green line is behind the lower one. This is called class 1, which is the reference situation for proper bite closure when correcting malocclusions. This type of malocclusion can also have an impact on the lip. You can see that if the upper incisors protrude a lot, as in this girl, they rest on the lower lip, which is pushed outward. This gives the lip a protruded appearance. Once the malocclusion is corrected, the lips return to a more harmonious, more proper relationship. That is, they are at the same level, the upper and the lower. This is the cephalometric exam, and it is what objectively confirms what we see. In the photos, you can see the upper incisor resting on the lower lip, which therefore appears to protrude outward at the beginning of the treatment. And then all these other measurements help us plan the correct movement of the teeth during the case study. Why should we correct a class 2 malocclusion? That is, a situation where the upper teeth are so much more prominent than the lower ones? Well, research also consistently tells us that there isn't really one particular appliance that's definitively better than another when it comes to effectively reducing this specific protrusion. However, treating very significantly protruding front teeth early on can indeed have substantial benefits. It can be exceptionally useful to proactively reduce the potential risk of losing these teeth later on. For example, due to trauma, because if they stick out so much, it's easy for them to be the first to hit the ground in a fall. And so they can be avulsed, meaning they are knocked out of the bone, and in that case it can be an indication for correction. Then another reason is bullying. In fact, there are certain types of bite that are related mainly to the fact that kids get teased, and these types of bites are, for example, having teeth that stick out a lot. Because it's very noticeable, so kids immediately see when someone has protruding teeth or very misaligned teeth, like in this case at the top left of the screen, or when the front teeth don't touch, or when there are these gaps. These malocclusions are the ones most frequently associated with episodes of bullying, so we need to work on improving them. These smiles, as we can see, were achieved in all these cases by moving from situations like these. So from very significantly misaligned teeth to beautifully well-aligned teeth that now close properly and perfectly, or even teeth with noticeable gaps in the very front. In short, our aim is to significantly improve this aesthetic gap so that it is no longer visibly apparent, or even for those teeth with a considerably large space in the front that we diligently work to completely close and bring together seamlessly with comprehensive orthodontic treatment. Because, of course, we may not change the world with our orthodontic braces, but we possess an enormous power. That is, the ability to change a person's life. Because we know that episodes of bullying are increasingly common nowadays, and we can truly help young people regain a beautiful smile. So confidence and self-esteem that allow them to live better and to find a good job. It will be easier for them to find work when they grow up, to have more self-esteem, to smile, and to experience time with others more peacefully. Therefore, we need to address the psychological aspect as well, not just the functional aspect of the correction. When should we start? Should it be when there are still baby teeth, or when the permanent teeth have already come in? In other words, when should we start correcting this class 2, these protruding teeth? Well, as we said before, if the teeth are very protruding and someone often falls and hits their teeth, then that might be a reason to start right away. But in theory, research tells us that the ideal time is usually during the growth spurt. That is when our kids start to get taller and grow. That's when the signs of puberty start to appear, like body hair and the first mustache in boys. Because from the literature, we know that this is the magic moment when the jaw also grows the most, and we can achieve the advancement, if that's what we need, of the jaw in half the time. If we are able to intervene and address this situation before the significant growth spurt occurs, we can still effectively achieve a substantial correction, thereby successfully fixing this noticeable prominence. But we won't have an appreciable increase in mandibular growth induced by the orthodontic appliance, and the corrective effect will be more about moving the dental arches and individual teeth rather than achieving significant skeletal changes. So we'll be acting less directly on the bones and more simply by carefully moving the teeth. And that approach can still be quite useful. Well, you can certainly wait to correct it, as we said, class 2, so even when there are baby teeth, but it's probably better to patiently wait for the permanent dentition. Because it's true that we can treat our patients with a retruded mandible even when they still have baby teeth, much like in this particular case. In this case, this is a full class 2 molar relationship, meaning the upper molar is completely ahead of the lower one. And we need to correct by a whole tooth. The bite can't close any further than this is the maximum, so we gather our data. You can see that this boy still has baby teeth, with the permanent teeth yet to come in. We do our cephalometry, our measurements, and we proceed. The case is resolved in about 2.5 months. We go from this initial state to this final outcome, meaning we have already successfully corrected the class 2 malocclusion to a class 1 relationship. That is, we've moved the lower tooth forward by half a tooth compared to the upper one. This is now a corrected class 1 in just 2.5 months, so in a very short time. And then this is the initial situation, with the upper tooth ahead of the lower one. We corrected in 2.5 months. And once he had changed all his teeth, this alignment remained fairly stable. So we're still in class 1, which means that sometimes intervening during the primary dentition works, but it's not the norm. Let's look at another case with the same skeletal structure. She extends it, the chin is set back. You can see the chin is retruded, and again she has a brachycephalic head shape, which basically means a strong bite. And this girl also has her upper tooth completely ahead of the lower one on both sides. We approach it in exactly the same way, so we do a case study. Do you see that there are still baby teeth in the arch? We do our own cephalometric tracing, same type of approach. And after 5 months, this girl is perfectly in first class, meaning we've corrected it. Her class 2 has become the so-called class I, the reference standard. But then, once we reach the permanent dentition, we find ourselves again with tooth against tooth, basically back to where we started. So, in essence, we truly need to carefully approach this particular case to effectively correct the class 2 malocclusion, which inherently means that what we generally know and understand is that it is usually considered to be the optimal and best time to address class 2 issues once all of the permanent teeth are fully in place. The permanent teeth, by their very nature, possess nice, well-formed cusps that are designed to fit together precisely. Consequently, you no longer lose that crucial interlocking fit, whereas baby teeth are typically very flat, so they tend to simply slide. They go into the correct position, but then, perhaps due to the rigidity of the muscles, the tendons pulling and trying to return to their previous position, the patient falls back into class 2. To summarize, when precisely should you start addressing class 2 malocclusion? Well, it can certainly be addressed at virtually any age, but it's often best to tackle it very early, meaning specifically at 7 to 8 years of age, when the permanent teeth are really quite noticeably protruding and at significant risk of fracture from an accidental fall. In general, in the vast majority of cases, it's usually much better to patiently wait until 12-13 years of age, which is precisely the time of the pubertal growth spurt. That's when our young patients grow a considerable amount, and the mandible also grows much more significantly. That's when we can achieve the greatest skeletal effects in the shortest amount of time. So, we extend our sincerest gratitude to you for taking the time to watch this comprehensive video presentation. We are always readily and enthusiastically available to address any and all inquiries, specific requirements, or intriguing curiosities that you might possibly have, and we genuinely look forward to assisting you further. Many thanks from the orthodontic office of Gioia Martinetti. See you next time.